Hello, my name is Michael White. I serve as the Chief Medical Officer for Valleywise Health. On behalf of Valleywise Health and the Valleywise Health Foundation, we'd like to thank you for your continued support of all of our efforts around the treatment of our patients with COVID-19. Your support of our frontline staff as well as our patients is truly remarkable. In this unprecedented time around the COVID-19 pandemic, it is truly wonderful to be part of such a supportive community. There are a number of questions that were submitted that I will take an opportunity now to answer and do my best to provide information that may assist you as you are going about your daily activities and your daily business. The first question I received is, should businesses ask customers to wear masks, and should masks be worn at home showings and open houses? As we continue to learn more and more about the novel coronavirus, which causes COVID-19 disease, it is transmitted by those droplets. So when people speak or cough or even breathe, there are just small droplets that can carry that virus. Wearing a mask and having people around you wear a mask helps prevent those droplets from being transmitted. The mask is protecting you from me as I wear it or those around you. It is not an unreasonable expectation to have individuals coming into a space to wear a mask. We're starting to see stronger and stronger recommendations from the Centers for Disease Control about masking in public in order to help us decrease the amount of spread of this novel coronavirus. The second question I was asked was, what are the risks with getting food delivered or takeout to your home or office, and can the virus be transmitted during meal prep at restaurants? Our biggest concern about bringing things into an environment is actually on the outside of the containers. So if someone who has been preparing the food or preparing the packaging has been infected with coronavirus and has then touched their eyes, their nose, sneezed, hasn't washed their hands, touches the outside of the packaging, and then that packaging comes into your environment, you touch it, and then you touch your eyes, your nose, your mouth, that is a risk of bringing the virus into your environment and transmitting it. The recommendation is, and has been for our food preparation individuals, to wear gloves, have somebody separate that's packaging that. As packages come in, wipe them down with some sort of cloth or remove the food itself from the containers that they came in. Wash your hands before you consume the food. The next question I was asked is, what is the best method for sanitizing a conference room after a meeting has taken place? All of the commercially available cleaning products that have sort of bleach and alcohol-based sanitizers will be able to successfully kill the virus. It's wiping down those places where people were sitting on the tables, the hard surfaces, the chairs. If somebody used a presentation remote, a computer keyboard, a mouse, you would want to wipe those down with any of those types of commercially prepared sanitary wipes are fine and are effective in destroying the virus. Do we know yet how long we can expect the virus to last before it has run its course, and will it be safe to meet in public groups? Unfortunately, this is one of those areas where we still don't know exactly what's going to happen with this. All of the work that we have done around social distancing, around not having meetings in these large groups, is really to decrease the rapid transmission of this virus. Our largest concern in healthcare is we get a large amount of people ill all at once that overwhelms the healthcare system, such as the stories we're reading in New York and Detroit. By maintaining the social distancing, by maintaining, the ability to not meet in these groups, we're decreasing the risk that this virus can be transmitted. Unfortunately, we just don't know how long these will be necessary to keep that rate of transmission into some controllable state. It may be through the summer that we see this, and we're just going to have to watch as more and more data becomes available. How long do we handle the workforce? Question was, how do we handle the workforce when we get called back to go to work after this is lifted? What should we be doing? As restrictions will slowly be downgraded within the communities, it's important for us to maintain vigilance. It's really counseling our team members if they are feeling sick or ill to stay home. It's really washing our hands. If we do have a cough, it's making sure we're covering our cough. It's those simple measures that help us diminish the ability of viruses to be transmitted within the community. As we go back to work, it'll be important for us to reinforce those as we go forward. Who does this virus really infect? There is so much information that does not all appear to be correct. You're right, there has been a lot of information and a lot of attention around COVID-19 disease as well as the novel coronavirus. Unfortunately, viruses will affect anyone across the human race and population. It does not discriminate who can get the virus, whether you're young or old, whether you're a man or a woman. It will affect all of us. Certain conditions or certain comorbid illnesses make people more at risk to have complications from COVID-19. So with those with chronic medical problems, those that are taking medications that may make them immunocompromised, those are populations that we are concerned about as they are at a higher risk for complications. What is the best information on the virus that is true and accurate? The Centers for Disease Control website is probably one of the most comprehensive resources that's available on a national level that does have true, updated, and accurate information. They also provide multiple recommendations around the social distancing, around hand washing, has some wonderful tools that you can share with your teams, and probably is the most comprehensive resource that we have available. Will the test for the virus show a positive result if you have ever had COVID-19 or only within a certain period of time? This question is nuanced depending on the test. If we are testing you because you are symptomatic and we are concerned that you have COVID-19 disease, we are testing at that particular time for you to have active virus or for you to be infective at that particular point for that. So a positive result there would demonstrate that you are currently infected with the virus and are at risk to transmit it to others. There are newer tests on the market which are called antibody tests, which are a blood test, which we draw the blood and then test your blood to see if you are exposed. Those are positive. That may show that you had the disease previously. It may have been a mild form. Again, as we continue to learn more and more about the novel coronavirus and COVID-19 disease, we don't know what antibody positive truly means. Does that mean that you're at a smaller risk to not get the virus again? Does that mean that you're at a smaller risk to not have a severe disease? We just don't know yet at this point. Further research is going to help us in these areas. I hope by answering these questions, I've been able to give you some positive information and some good information around COVID-19 disease. Thank you again for your support of the Valleywise Health Foundation, as well as Valleywise Health. Stay well and maintain that social distance for now as we do our part to reduce the spread of COVID-19 disease. Thank you so much.